an adenosarcoma that presented itself in the lower part of my pelvis, and it had also gone through my vaginal wall. There was discomfort with intercourse, and I'd never experienced that before, even though I've been postmenopausal for years. That was new, and that was a direct result from the radiation.
After the first surgery, we didn't expect that it would come back and that she'd need radiation. And so when patients do meet with our radiation oncologist, they talk to them about some of the anatomic changes and things that they can do. The atrophy is just something that's inevitable.
Some of my symptoms other than discomfort was I was getting frequent UTIs. Once the radiation was done, I was just feeling better and better because the side effects of the radiation were gone. Didn't have any discomfort with intercourse at all, probably until midsummer.
It's an erbium laser, and it penetrates to the dermal layers of your skin, so the deepest layers where your blood vessels and your collagen are. So it promotes new tissue growth, new blood vessel growth, and it's just kind of turning back the time. So you're thickening the vaginal tissue, which unfortunately after menopause just tends to thin out over time when we don't have our estrogen. And even for women like Cindy who can't use vaginal estrogen, this is really only her only option. Women that have stress incontinence can benefit from this. It thickens the tissue under the urethra, providing some resistance so that they don't leak as much with like cough, sneeze, laugh. Women that have dryness and pain with sex also have a lot of benefits from this. And usually that's due to atrophy or the thinning of the vaginal skin. So regenerating that can help with the tissue thickness, so less friction, and it can help with lubrication as well. We'll use a topical numbing cream that I let sit for about 15 minutes, so there's no needles involved at all. And that is truly the longest part of the procedure. The laser is really automated, and it takes me about 2 minutes to do an entire treatment. And you should have little to no discomfort at the time. You can go back to your normal life afterward. And the only restriction is just no intercourse for 48 hours. But I have ladies go to kickboxing right after, and they do just fine.
I did initially 3 treatments a month apart and had a tremendous result. My vaginal wall plumped back up, no more UTIs, no more discomfort. And then about 6 to 8 months later, I noticed that the discomfort was coming back. So I met with them again and they said, I'm probably more of a candidate to have twice a year. It was a game changer. I just felt like I got my body back. Because between, the diagnosis, the radiation, you just don't feel like yourself for so long. And I thought, I just wanted to feel feminine again. And the laser did that for me.